Well, my name is Maria Baldasare. I have been a cardiologist now for almost 5 years. I'm triple board certified, so I'm certified in internal medicine, general cardiology, as well as interventional cardiology. Why I wanted to become a cardiologist is actually a personal reason for me. My father had ended up needing triple bypass surgery when I was in my last year of medical school. So since then, I've always been interested in cardiology, but his illness really pushed me towards the field. I'm very excited to be a part of the OCH family here. Prior to me coming out to Northwest Arkansas, I was in Kansas actually, so I'm very well familiar with the lack of access to specialists essentially, and also, especially cardiologists. So I offer a wide range of services, from non-invasive cardiology, meaning your run-of-the-mill high blood pressure problems, chest pain issues, fast heartbeats, passing out episodes, for example. I can read stress tests, echocardiograms, Holter monitors as well, and can also do the more invasive things. I put stents in your heart or in your legs. I do structural cardiology. For example, with Watchmen procedures, I can certainly do those if appropriate for patients. So I offer a whole host of things that the public may need. My biggest passion is, number one, women's health care, especially preventative women's health. So that's something that I'm passionate about, and I love to see females more involved with prevention of heart disease and how to get themselves healthier. And I also like atrial fibrillation. That's also one of my favorite things to treat. So I had mentioned earlier that I do the Watchmen procedure. This is a great evolution of technology for our patients who have atrial fibrillation and are on blood thinners. Oftentimes when we prescribe blood thinners to our patients, we're telling you to take it the rest of your life. But there are some conditions that are prohibitive of taking blood thinners. For example, if you've had bleeding issues from before, if you fall a lot, you're just getting more frail, you're bruising a lot. These are all high risk markers for bleeding events in the future. So what the Watchman does is it essentially includes a pouch in your heart that can fill up with blood and form clots. So this is where strokes come from when people have atrial fibrillation. And what this device does is it actually plugs up this pouch so that blood does not get into this space, does not clot, and then we're able to take you off the blood thinner. As far as implanting, I've been implanting this ever since training. I trained back in Philadelphia, so we were part of the original clinical trials of this. This was FDA approved in 2015. So I've been implanting this as a fellow in training and also now as an attending for the last 5 years. So I've implanted over 100 of this, which is the most in Northwest Arkansas. So I'm very, versed in the left atrial appendage, and I'm excited to offer it to patients as a nice, safe alternative to blood thinners. So how patients can find me? First of all, in Northwest Arkansas, there are only 2 female cardiologists in the area. One of them is me. And if you look for interventional cardiology female, I'm the only one in town. So it's pretty easy to find me. My office is mostly in Bentonville, but I do come out here to OCH just recently and have clinic out here for my patients in Gravette and the surrounding areas. The easiest way to contact me or to make an appointment would be to call the specialty clinic here at OCH.